So having a tiny snack here. All right. Ms. Nicker, I sent you a little text message heads up asking you if you would please lead our Pledge of Allegiance.
I would be happy to. Honored.
Thank you. All right. Let's see. I'm just giving Mr. Tolbert just a second. But does anyone else's computer not match their phone time?
Mine does not match my phone time, and I have signed on 1 minute past roll call multiple times because of it, and I'm finally 13 months into this thing realizing that that's bad.
I think
here. That's how mine is too.
Is real time though. Yours is not lined up, Ms. Yang?
Correct.
Oh, technology. Okay, well, why don't we, if Ms. Moore is ready to rock and roll, we will get rolling.
I am ready.
Okay, great. So the St. Paul City Council will come to order. Roll call.
Naker.
Here.
Prince.
Here.
Tao.
Here.
Tolbert. Yang.
Here.
Jalali.
Here.
Council President Brenmoen.
Here.
6 present, 1 absent, being Councilmember Tolbert.
All right, please stand and join Ms. Naker as she leads us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent agenda items 3 through 19 are before you for your consideration.
All right, and my understanding is that we are taking item 18 under or for separate consideration. Is there anything else that should be taken off consent? Seeing none, Ms. Yang moves the balance of the consent agenda. Roll call.
Naker.
Aye.
Prince.
Aye.
Tao.
Aye.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The consent agenda is adopted as amended. Item number 18, Resolution 21-164, expressing the city's priorities for the MnDOT Rethinking I-94 project.
Great, and this item I know has a lot of support, but there's 3 authors listed. Does anyone want to take the lead on this discussion piece? Mr. Tao?
Thank you, Council President, and thank you to all the sponsor, Councilmember Jalali, Councilmember Prince, and Councilmember Yang. I'd really just like to take this opportunity to summarize the Rethinking I-94 project. It's to lift the work that the community organization have been doing and to share collective visions and value for this project. Moving forward with MnDOT, the project is led by MnDOT. The condition on Highway Avenue in Minneapolis to Marion Street in St. Paul has deteriorated to the point where MnDOT will have to do more than just mill and overlay it annually. Currently, they're in the second phase of environmental documentation phase. It will be drafting its purpose and needs statement and goals for the project. The community stakeholder have been engaged very closely with MnDOT and the city on this because the city will definitely have a say in how this project gets shaped and completed. Our office has been brought together with stakeholders, the advocates, to push for a unified values and vision for bringing economic, social, environmental justice to this project. We acknowledge that the past harm have been done through the original construction of I-94, where it displaced a predominantly thriving Black community and stripped away generational wealth from them. By acknowledging this, we want to use this opportunity to right the wrongs of the past and center the voice of Rondo and its descendants and make sure that whatever is invested here benefits the community and creates economic opportunity for the descendants of Rondo and the current residents in the neighborhood. We also want to make sure that the health disparity do not continue along the corridor that has been in access to multimodal transit, and that our environment and our air quality has improved. In passing this resolution, we urge MnDOT to continue to be a partner and to center the voice of the community and
I think he froze.
staff in Public Works and the Mayor's Office for their partnership, and especially want to thank the community organization for their continual persistent resiliency in partnership with this. Even though this project may re-trigger trauma for many who have been impacted, we know that there's much at stake, and that is our connected future to this land and to this environment that will continue to bend us together. And with that said, I'd like to ask all my colleagues to support this resolution, and love to hear from the other co-sponsor as well. Thank you.
Right. Thank you, Mr. Tao. Ms. Jalali.
Thank you so much, Councilmember Tao, and to the Ward 1 office, who has really played a huge role in convening our community partners and making sure that we're centering the voices of our Rondo community, the descendants of our Rondo neighborhood who were displaced by the destruction of their neighborhoods because of racist urban renewal, highway and transportation planning policy, and a federal legacy that is ugly and reaches back decades. I'm so thankful to the dozens and dozens of constituents from my part of the city who are also living in areas along and through the freeway, who are standing in solidarity with all of our communities affected by 94. And I think this resolution is an important message to MnDOT that our community is talking about reparations. Our community is talking about forward-thinking action on climate and the expansion of transit, not the expansion of lanes that have historically hurt our community. So I hope that this sends an unequivocal message to the kind of vision and engagement that we expect and are looking for. And I'm really looking forward to continuing those conversations and also advocating for the community that we want for our future, that both rectifies the harms of the past and also plans for our climate, plans for our planet, plans for the restoration of the wealth that's been stolen from our residents, and makes a home truly for everyone in our community. So just want to make sure that we speak for the record, and thank you so much to everyone supporting this resolution today.
Thank you, Ms. Jalali. Ms. Prince.
Thank you, Council President Brennan. And thanks to Councilmember Tao and his office for their leadership on this. I want to particularly call out my Chong Zhang, Councilmember Tao's legislative assistant, who provided just incredible numbers of hours getting all the whereases right, making sure that this does what it needs to do. And it was truly, obviously, for the Ward 1 office, a labor of love and a commitment that we are, as the city of St. Paul, learning from history, not to repeat it. And I also want to say that to Ms. Jalali's point, this, like reparations, is one that is coming to us from the community. They are leading us from behind to say, these are the issues that are important to us. We want you to join arm in arm with us to ensure that this is a good project for everybody, and that we are specifically going to turn what were negatives of the past into positives of trying to determine the best, most sustainable way to have this project move forward. So I am really happy to be a sponsor and grateful to this council for again showing real leadership on an important issue.
And I guess I would like to jump in. I want to acknowledge the impacts of Rondo, and I appreciate that being called out. And I also want to just take a little turn a little bit towards the east and say that when one of my biggest regrets in my work here on the council is that when I first started, we passed municipal consent for the reconstruction of Highway 35E. And at the time, I mean, I was very new and wasn't, it seemed like it was like 2 months after we had started, and not really I think far enough along where it was hard to feel that there was any opportunity to influence change. And really what ended up happening as a result of the construction project on Cayuga was we removed sidewalks on a lot of the bridges that crossed the interstate highway. So there's only a sidewalk on half. And the idea was that, I think there was a county commissioner who didn't want to have a sidewalk on one side of the street, so she advocated for a sidewalk on only one side. Maryland Avenue looks like a landing strip for a 747 airplane. It is huge, wide, overbuilt. Cayuga exit ramp is empty and overbuilt. And I think, and probably worst of all is we disconnected the Gateway Trail, where it connected from Arlington across an old abandoned railroad trestle and into what is now Trout Brook. And actually in the project, we built a tunnel to go under Maryland, but yet still to this day, that project has not been completed because we haven't gotten the funds to basically reconnect the Gateway Trail. So a beautiful trail that's been expanded east into Matamidi and down into Stillwater abruptly ends essentially when it gets to some of the poorest parts of downtown St. Paul and just ends. And there's, some spin-off paths that put you behind an old abandoned retail center. No paths go under the tunnel that we painstakingly built. And so it's a catastrophe in so many ways. And so I really regret not having the power of a strong community voice, like we find in Rondo, and that foresight in many ways to be able to put my foot down at that time and really demand a person-friendly reconstruction project. And I think that was an opportunity missed. So I missed the opportunity to sign on as a sponsor of this, but I wholeheartedly would love to be. And I, again, just mostly regretful that some of these things weren't in play when we did our work on 35E, the big Cayuga project. Something needed to be done there, but I think that maybe what we ultimately did made matters even more worse than they were at the time. And I will come to you in the months ahead looking for support on plans to move forward with that Gateway project, because we really do need to finish that for our community. So not to hijack the conversation.
We don't hear you anymore.
I think you're
on mute, Council President.
Well, hopefully not
2 sentences.
Anyways, bottom line, some of these things could have been avoided with Cayuga. So I really fully support this resolution, and I only wish we would have had one when we did that project. Ms. Yang.
Thank you. I want to say thanks to Councilmember Tao, the Ward 1 office, and also all the different leaders and organizers who are a part of this. I feel like there's so much deep solidarity around this, and it's so inspiring to see, and want to name that while it is so much like this is so triggering of a lot of the racial and economic injustices that our community, especially our Rondo community, has experienced. I also want to name that it's also so healing to be able to see the power of people coming together, and hope that it is also a really healing experience for everyone to see what we can actually accomplish when we're pushing together as a mass of people too. So thanks for leading this. I'm really honored to co-sponsor it, and if there's anything that we can do to continue pushing alongside you all, the Ward 1 office too, please let us know.
Yeah, thanks. All right, so Mr. Tao moves approval. Any further discussion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brennan.
Aye.
7 in favor, no one opposed. The resolution is adopted. Item number 20, Resolution 21-187, approving the appointment of Caitlin Grady as legislative aide in Ward 3.
Mr. Tolbert.
Yeah, well, thank you very much. I want to take the opportunity to welcome, pending approval of this, welcome Caitlin Grady to to the City Council. I think she's going to be fantastic, and I know many have not had the opportunity to meet her in person, but I think you've seen her on meetings, and I look forward to working with her, so I hope you'll support this resolution.
I will definitely be supporting the resolution and only say that it's a shame that we can't do this in our council chambers. It kind of makes things feel really real when you start this work at the City Council and you get to be like sworn in or appointed in the council chambers. So let's make sure that we take an opportunity one day when we're back in the chambers to do this officially as well. But I welcome Caitlin as well. She's been on some of our pre-council meetings and she just jumped right into the fray. So I think she's going to be great. So Mr. Tolbert moves approval. Any further discussion? Roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The resolution is adopted. Item number 21 is an update on COVID-19 vaccinations.
And this is just a report from the St. Paul Ramsey County Public Health crew. I think Deputy Director or Interim Director. Ms. Anderson, you can explain or clarify your title from St. Paul Ramsey County Public Health. I'm here to give us an update on the vaccination rollout. And we discussed this last week about the importance of getting regular updates, and not only for our information, but for folks that tune into our meetings and to find more ways to disseminate information as it is known about our vaccination program. And I think Rick Shute, our Emergency Management Director, is here as well. So I will put things over to you, Ms. Anderson, and maybe just start by correcting me on messing up your title.
It happens a lot. Thank you, guys. My name is Laura Anderson. I manage the health protection team for St. Paul Ramsey County Public Health, and I am currently the incident commander for our vaccine response related to COVID-19. So I've been working very closely with Director Shute over the past, to be real, I've been working closely with Director Shute since about March of last year, and I am very glad to be here and to talk about vaccine distribution, which to me is a bright spot in our COVID-19 response. We are actually able to move forward and be a bit more proactive. So it's a good place to be, to have access to some vaccine. So I was asked just to give you guys a quick 5-minute update. I thought I would focus on 3 major points. I want to talk a little bit about safety and efficacy for the FDA-approved vaccines that are available in the state of Minnesota. I also wanted to touch briefly on where we are in terms of vaccine distribution and phases of distribution in Minnesota. I know that's been a hot topic. And lastly, I just wanted to briefly share with you some ways that our residents can be more involved in terms of supporting the vaccine distribution efforts and really supporting each other as neighbors and friends, helping out with health education as best as we can. This is a big push, and we're all in it together. So I promised that I wouldn't share slides and bore you to tears. And I should also just state briefly, I'm not a doctor, I'm not a physician, so if you have specific questions about the trials that I can't answer, I will go ahead and share those back with our medical director.
She is wicked smart, though.
Thank you, Director Shute. I appreciate the vote of confidence. So I just want to state, we've been hearing a lot again in the news about the vaccines that are available, and we're also hearing some contradictory messages or some varying messages about variants. And I wanted to just briefly share with you right now, the vaccines that we have available here in the U.S. are very safe and effective. They've gone through multiple trials, and I would argue that the risks of COVID-19 disease far outweigh any risks associated with the vaccines that we have available to us. Both the Moderna and the Pfizer vaccine, those are the mRNA vaccines we've been hearing so much about, had long trials that did include include individuals who self-reported as Black, Indigenous, people of color. Very similar vaccine efficacy, typically 90 to 100%, observed across all subgroups, no matter age, sex, race, ethnicity, or the presence of comorbidities within those populations. You may have been asked, or perhaps you were wondering, if these mRNA vaccines actually change our DNA. I know I've had some friends ask me that. I just want to reiterate, messenger RNA vaccines have actually been researched for about 30 years. And the reason we were able to move along on production with the Pfizer and Moderna vaccines has to do with us, frankly, being in a pretty untenable global pandemic, and countries across the world moving a lot of funding over to research and coordinating that research so that we could really kick this up and ramp up research and development for mRNA. So that messenger RNA, it doesn't actually enter like the nucleus in your body. It actually just, it has sort of a tendency to print or mass produce. Basically what it does is it reaches out. Basically, there's like this little tiny part of the vaccine, this spike protein piece. And what the mRNA vaccine does is it allows your body to create immunity to that spike protein. But it doesn't actually make you sick with COVID. It's not like you're going to show up with a positive COVID test as a result of receiving the vaccine. So I just wanted to share that now. Historically, we're more accustomed to what we call viral vector vaccines, where we have like a dead or an attenuated component of an existing virus, and we inject that into our body to ramp up an immune response. The nice thing about the mRNA vaccines is that, again, you can ramp up production much more quickly. So these are good things for us. I am aware, and again, I'm sure you're hearing this on the news, the Johnson & Johnson Janssen vaccine is currently being reviewed by the FDA. And I'm really excited about that vaccine coming online because it's a one-dose series, so you don't have to go back for 2 shots. And it also requires less significant storage and handling. So you don't have to have like access to a ultra cold refrigeration in order to distribute that vaccine. Okay, so moving right along, I'm sure you guys have all seen, I was going to share my screen, but I can't, or can I? Sherry, can you give me?
Yes. I was going to say, Laura, that would be really helpful because we also aren't doctors. So I'm gonna make you a presenter.
Okay, awesome.
And that. There you go. That would be helpful.
Okay, cool. Well, I will go ahead if I can figure out. I just wanted to share. Give me a minute. If I can. Is the suspense killing you? It's killing me. Okay, hang on. Okay, this is going to be tricky, but I'll try. Okay, so now we're in a parallel universe where you can probably see yourselves and me concurrently, or can you just see my screen?
We can see you in the website of vaccine distribution by week timeline.
You probably don't want to see both of those things. How does this look?
Perfect.
Great. Okay, great. So I wanted to give you guys just, again, context for where we are in terms of vaccine distribution. Right now, as I'm sure you've heard over and over again, the state is still working through what we call Priority 1A audiences. So that does include folks who work in hospitals, folks who work in long-term care facilities, and also the residents of those same congregate settings. We have in Ramsey County, in St. Paul, we have a lot of smaller congregate facilities that really need special attention and care to assure that they have an opportunity to receive the vaccine. So we are working through those smaller congregate settings as well as unaffiliated healthcare clinics, clinics that aren't associated with a large system, a lot of other healthcare staff who have been working very closely with our constituents, again, for the past 10 or 11 months. That can include folks, dentists, chiropractors, acupuncturists. There are a lot of our community members who work within those healthcare settings. Now, at the same time, I'm sure you're aware that Governor Walz did execute, made some big moves in terms of pushing us further out into 1B, and that's primarily been through these community vaccination sites that you've heard of. I know that Roy Wilkins Auditorium was the site for a site for teachers and childcare just last weekend. We also, had the opportunity, many of our adults over the age of 65 had the opportunity to participate in a lottery system in order to receive vaccine at a community setting. Just this morning, I'm not sure how closely you guys are following MDH's website, but I am. We were able to commit, the state has now committed to additional vaccine being shipped more directly to private healthcare, federally qualified health centers, as well as pharmacies. So typically the big chain pharmacies, but there may also be more opportunities for smaller local pharmacies to have some access to vaccine, because we know that the larger community sites, they may not be as accessible. Certainly having to access a web form and then wait in line in the cold, those systems, I think, unfortunately, what they're really reflective of is just not having enough vaccine in our community to meet the demand. But I do think this is a pretty useful, this is on our Ramsey County website. I believe you guys have similar communications going out to your residents as well as your employees. We have, we've moved a little further along, and we're working very closely with Director Schutt and St. Paul Human Resources to make sure that as more vaccine comes online, we have an opportunity to make sure that our essential workers, again, are offered access to that vaccine. If you haven't had a chance to review this, the Minnesota Department of Health is updating their publicly available vaccine locations. So take a look at this map. I can search here. If you can see my screen again, I'm searching for St. Paul. Let's see what's available in my community. See, again, looks like depending on where you are in your zip code, you may have an opportunity to call a clinic and see what, if vaccine is available for you. So I'm going to go ahead and stop sharing my screen now briefly. Whoops, or am I? Wow, you guys this is fun for everyone. Sorry about that. Okay. I feel like I've gone far beyond the 5 minutes that were allotted to me. I do want to give Rick a chance to talk. He hasn't had a moment to talk about the partnership that we've established, again, starting much earlier last year with outreach and testing and now moving into vaccination, I think we have a really good relationship established. And I think we're going to be able to work really closely together later on this year and get a lot more people here in St. Paul vaccinated. We're building capacity as we speak and just look forward to partnering with you guys more.
Great, thank you. Ms. Naker, before we move to Mr. Shute, Ms. Naker has a question.
Thanks, Council President. Thanks so much, Director Anderson. Just to be super clear, because I think the pilot was a little bit confusing, the pilot happening and then going away. So we're in 1A, so it's just healthcare workers and employees and residents at long-term care facilities, not people age 65 and older and K-12 teachers and that kind of thing, or can you clarify that part? And then secondarily, the sites that you just showed on the screen that you can search to see if you can get a vaccine there, I assume those are still only within whatever priority group we're in. It's not like you can bypass the system and just make an appointment. I could do that today.
Yeah, you're bringing up very appropriate comments. So the community sites that the state has established were for 65 plus, as well as teachers and childcare. And as of earlier, I believe even today, the state released some information indicating that they will be moving to 2, potentially 3 permanent sites to address the needs of those audiences. But one is in Minneapolis, one is in Duluth, and I think they're looking at an additional site somewhere in southern Minnesota. Sustainment here is just going to be an ongoing effort. And again, yes, I've heard varying levels of ability to access vaccine for individuals who are 65 plus. It really, each provider has their own set of criteria that they're utilizing in order to offer vaccine to their patients.
If I could add to Council President.
Mr. Shute, did you have something to add to that?
Yes, the way I'm kind of visualizing and explaining to folks is there's federal efforts, there's states efforts, and there's local public health efforts. And the only thing that is linked between those parallel efforts is the vaccine supply, the federal vaccine supply. So they are parallel. Some can move in front of the other, and they are not necessarily linked or coordinated serial in nature. So what I'm able to work on for the city and with Laura and St. Paul Ramsey County Public Health, we aren't consulted on the pilot programs. We aren't consulted on Roy Wilkins until after the decision's made and that initiative is moving forward. So that also, I think, is adding some confusion and question to the environment. It is not serial in nature. They are parallel efforts. And like I said, the only thing linking us is the very limited federal supply of vaccine.
Great, thank you. Ms. Naker, did you have a follow-up?
A super quick follow-up on that. Thanks. And nothing about the way that we have handled this pandemic has been clear or well done, and that's not at all a dig on either of you. That's the federal issue. But so then just to make sure I understand, is it the case that depending on, you said that they're parallel efforts, Director Shute, so depending on who you go to try to get your vaccine, whether that's a private provider, whether that's a pilot site, that different people at different ages and different priority levels might actually be able to jump in front of other priority groups?
Was that directed to Mr. Shute? Yeah, Mr. Shute.
I'm not sure if I understand the question exactly, but it may appear that way. But I know that the CDC and the federal government, the CDC, they lay down the prioritization. That comes down to the state, and the state has also they have an advisory board, and Laura can remind me of the composition of that board. But they review that guidance from the CDC, and then they in turn publish the guidance for the state.
Did that answer your question, Ms. Naker? To the extent possible?
I think if I could just add something, Ms. Naker, the alignment is improving over time. I think that jurisdictions across the metro are doing their best to stay in lockstep with the state. You can imagine how challenging this can be when you look at how distribution is allotted across jurisdictions that have fewer residents versus jurisdictions who have more concentrated populations. So we are moving as quickly as we can to really address the needs of individuals in facilities, who are at greatest risk before we move further into other populations.
Great, thanks. And it does seem like every morning when I read the paper, there's more producers coming online with their vaccines and production increasing. So I see Ms. Jalali has a question, and then Ms. Yang.
Thank you. My question kind of gets to the chain of command questions. I think some other people have asked about different streams of work and who makes the call and where it's coming from. So we see a lot of us just regular advocacy for different groups of people who are also arguably very vulnerable and because of vaccine limitations aren't necessarily yet reflected in the priority order, but especially need advocates to be able to fight for that. So if we want to, as council members, be able to communicate officially strong support for things like being able to get vaccines to folks experiencing homelessness, being able to get vaccines to people who are currently incarcerated, subgroups of folks that there's lots of community advocacy around nationally and locally, what is the best way to direct that advocacy? Is it to the Walz administration and Department of Health? Is it to our federal delegation? Like, where should we actually direct those efforts so that we make sure people know this is a priority? This is a priority, sorry.
Yeah, that's a great question. I would absolutely direct those that energy toward the governor's office at this point. I think that is where the rubber meets the road on some of these decisions. Yes. And we did see some changing. Initially phase 1A, for example, did not include workers at homeless shelters. And I believe starting in the first or second week of January, that guidance was modified. So there are some changes occurring, based on what we know locally.
Right. And I perceive the highest pressure is just limited supply, but if and as we hopefully see that get boosted, I expect our advocacy to become even more relevant, and it is already relevant. So thank you for that info. That's very helpful.
Thank you. Ms. Yang, and then Ms. Nager.
Thank you. I was wondering if you can share, other than supply, like what are the biggest barriers that people are facing in getting access to vaccinations? Because I did hear one of the first things I heard was like people who don't have internet access, they are having trouble, getting appointments because they don't have the ability to be able to do that. And then I've also been seeing a lot of statistics around who has access to vaccinations, and there's a lot of deep racial and economic disparities amongst that data already. Mm-hmm. And then what are steps being taken to close those barriers too?
Yeah, so again, I really appreciate that question. We've been reviewing our race ethnicity data, even within the few thousand residents who we've been able to vaccinate. I absolutely concur that an online system with this lottery function has not been the most accessible. I have shared with our MDH colleagues some interest in developing other ways for folks to access those clinics. I know that in the past with testing, we had cohorts of community outreach workers who would support people in making appointments for testing. So I can imagine something like that coming online pretty quickly. We've gone ahead and started translating our screening forms and materials without any, as we should, based on our city's needs. And I think in the near future, your local health department will ourselves be setting up a call center in order to support some of these registration hurdles. It's not going to happen, it'll take a bit of doing to get to the point where we have enough vaccine available to make that hotline useful, but I think we're going to get there sooner rather than later.
Ms. Yang, did you have a follow-up?
I do. My follow-up is I'm wondering how like you envision us as local elected officials supporting that effort and finding other methods. And did I lose everyone? Oh, okay. It's just the screen. How do we support you all in finding other methods to get folks, lined up to get vaccinations?
Mm-hmm. Well, I would be very glad to connect you with our community outreach folks, and we could align some efforts there. We have a really active Medical Reserve Corps group who has also been hugely supportive, hugely helpful with outreach designed for our communities. So that would be another good onboarding, for residents or others who are interested in really shaping this distribution so that it's more equitable. I can put that
I'd love to
in the chat. Yeah, and I will connect you with some other folks after this meeting.
And that information, if you want to share also with Ms. Maloney, our council director, I think we're all interested in those responses. So thanks for asking, Ms. Yang, and thanks for sharing the response with all of us. I have Ms. Naker with a hand up, and then also Mr. Tao.
Thanks, Council President. Director Anderson, I think one of the big picture questions I'm hearing from constituents is just this overall concern that, again, I think largely due to national news, that vaccines are coming in and are not being able to get out the door and into arms quickly enough, that they're sitting around, or that the efficiency is just not there. So can you tell us how many vaccinations are being given per day or per week, or some sort of measurement like that in either St. Paul or Ramsey County, and how that compares to the number of doses you have available? So in other words, are we getting out all of the ones that we have as quickly as we get them in?
Yeah, absolutely. We have a web page. Again, I want to share my screen, but I'm so slow at doing that I'm going to go ahead and put it in the chat for you guys, where we have been listing how many doses we receive, how many we're able to allocate, how many clinics we're doing. It's relatively transparent. The state is doing the same level of work around private healthcare and pharmacies. And I think our governor's decision, again, to push out 100% of doses within 7 days of receipt has really, that metric was very ambitious, but clearly it's had a good impact in terms of getting the vaccine out there. We've seen really large increases in numbers of total vaccinated over the past 2 weeks. And I'm guessing that his direction was a part of that.
Ms. Anderson, if it's all right, I know that it's a little bit clunky, but part of the reason why we're doing this is so people who are watching can see. So if you could possibly pull up your screen, I think that would be great. Yeah. And sorry to do that too, because I know I don't want to share my screen. I can't imagine how bad I would mess that up, but.
Well, it's good for me to learn. So again, I'm going back to this vaccine webpage here. This is on the Ramsey County homepage. And here if you click on this link here, summary of vaccinations, this is just the vaccine that local public health has been allotted and been able to distribute. So really, this is about 10% of the total doses. This is a small component of the total doses that are available within the metro region. I just want to make that clear. We actually summarize and share this information weekly. So again, you can see pretty closely, if you scroll down, it's based on time. So when we first started, we received, for example, 1,700 doses, only held 3 clinics, right? I mean, that's, and then again, if as you move forward, you will see significantly larger output, including some second doses given. So you'll also be able to see, it's somewhat useful. And I will go ahead and share Within our situation update, I believe as of today, we've been able to vaccinate a little more than 4,000 people. But if you look at the full Ramsey County situation update, you will see we're keeping tabs on residents in Ramsey County who have received at least one vaccine dose. So that's all available for your review. And yeah, so I think you can also actually from this page, you can take a peek and see where the state is in terms of tracking doses received and allocated. This webpage can take a little bit longer to load, but again, contains some really useful information around how much vaccine is out there and how quickly it's being administered. I just want to give you, so again, this is the statewide profile, which shows, a little under, 458,000 residents in the state of Minnesota have received at least that first dose. And then if you select for Ramsey County, you will see 40,000 doses administered within our county. This is pretty commiserate to doses administered in other counties. If you hover over each county, you can see the proportions. So here in Ramsey, 7.4% have received. Over in Hennepin, I guess they're a little ahead of us today. They're at 7.7% administered at this time. So just, another resource for people to check.
This is a great resource. I'm looking at it appears that if you go to mn.gov, it's fairly easy to navigate to the COVID information. And then Ramsey County's simplified website is just ramseycounty.us. And these are both very helpful. And I'm definitely going to go back and look at the definitions of some of these essential services, because throughout this pandemic, I've thought to myself that really our grocery store workers and, hair people working in hair salons and all these services that, we need. One time I heard somebody say, I just have somebody, or I just use like Instacart. And I'm like, someone's still shopping for you. It's important work that we've really relied on people who kind of keep things rolling. And I certainly hope that they are prioritized over me. I have the privilege of staying home to work. So I know. And so, again, that's mn.gov to navigate into the COVID-19 or ramseycounty.us. Mr. Tao has a hand up, and then Mr. Tolbert.
Thank you, Council President. Director Anderson, have there been cases where the vaccine has caused some sort of allergic reaction and the recipient, and then what have been the way to reverse that effect?
So, Mr. Tao, during the trials for Pfizer, there was evidence of around 10 individuals having what's an anaphylactic reaction to that vaccine. Moderna had slightly fewer allergic reactions associated with the vaccine. None of those allergic reactions have caused permanent issues with the recipients, though. At our vaccine clinics, we always make sure to have an EpiPen available. Just in case. We monitor individuals after their vaccine for 30 minutes if they have a history of allergic reactions. And that way we can, promptly obtain medical care for them if they should. We have not seen any of those reactions at our clinics yet.
Mm-hmm. And in that study, was there like a underlining or common denominator of those 10 recipients?
Not that I'm aware of, no. I've read a little bit around folks with, these were individuals who had previously had pretty significant reactions to other vaccines. So if you had a flu shot and your throat started to swell up and you couldn't breathe, that would be a history, that would be a significant reaction where our screeners might say, ooh, okay, let's talk this out a little bit more. Let's talk to your provider before we go further on this. So that would be the common denominator for those few individuals.
Mm-hmm. And what about communities who don't typically trust vaccine, whether it's flu or COVID-19, and what has been the county's effort to reach and to build those trusts?
Yeah, I think that's another really good question, Councilmember Tao. We have had a community outreach team that has been in the field since March of last year, developing relationships with local residents, churches, looking at less conventional, medical providers, pharmacists, other, community providers who are seen as trusted experts. Our hope is to utilize those community connectors throughout the vaccine response. I think a lot of people are hesitant to receive a vaccine that hasn't been out in the world before. So we're not just going to offer it once and run away. We're going to be out there offering vaccine for a long time, so that folks have time to make sure they're making the right decision for themselves. Yeah.
Thank you.
Thank you, Mr. Tao. Mr. Tolbert.
Yeah. Thank you both for being on this call today. I think I'm one of the reasons that you guys are joining us, and part of my reasoning behind this is I think a lot of us know that there is a lot of work going on at the local level, but sometimes if you don't know that it's going on, that can make people more anxious. And I think just getting this out there, even if it's not the answers that and I know, in a perfect world, you'd say, we have a vaccine for everybody, come get it tomorrow. But even the answers we don't want, just knowing that the work and the preparation is going on is really helpful as we communicate that and look to us as partners. One of the things I do want to just recognize in the difficulties that both Ramsey County and St. Paul, and quite frankly the state of Minnesota, has had, is just to remind everybody that the vaccination rollout preparation was every state and local government was told something, and a few days before the administration change, it was announced that what we told you is not true. The vaccinations that we told you the amount of vaccination that was coming is not true. Basically, the vaccination rollout plan was a bluff, and they admitted it a few days before. And I think, it was very telling and jarring to me that, the chief of staff of the new president basically said, we're basically flying an airplane that is crashing, and we're just trying to get in the cockpit to figure out what is going on. There is a lot of issues there in terms of the transition, everything like now, but I think as we've even seen over the last 2 weeks, me watching from afar, now that we have adults in positions of leadership in the federal government, it is starting to work its way down in a more, in a way that state and local governments can anticipate what that's going to look like, so we can give the real information to people rather than get people's hopes up and then change it because we had our hopes up in some ways. So I think, having a president that has said, I'm going to under promise and over deliver is something that I suspect in your roles you guys appreciate. But I do want to just say, use us as people who can get information out. We are, in touch, and we do get information out to our neighborhoods very quickly. And a lot of times people call us, even if we're not the right level of government to do that. So reach out to us. And maybe I can just touch on a few things that I didn't hear. Maybe they're later in the presentation, but I believe you guys have a town hall tomorrow for people who have questions about vaccination. Is that's online it starts at 5 p.m. with Ramsey County, Laura?
That is correct. I will be at that town hall.
Okay. And then I think there are text and email updates people can sign up for.
That is also correct. Yes. Again, at the same website, I will go ahead and share that with you guys. We are proactively pushing out a Gov Delivery newsletter to any constituent who wants it, just to keep them in the loop around where we are with vaccine.
And so I just say, reach out to us. I think the MDH website is really good. I visited it. Your guys' website over the last year, you've really stepped up your game. The data and the charts and all that stuff is, as we just were looking at, is really good and appreciative. But I thank you for all that you guys are doing. I know you're dealing with things 4 levels down from where a lot of the important decisions are being made and trying to react. But I think the reason we want these updates on a public manner so that we can help get that information out. And there's probably a few reporters watching this as well who possibly could write an article to help transmit that information out to the general public as well. So thank you.
That sounded like a hint to me. We really do appreciate this, and the intention, of course, is to have you back. At the first meeting of every month, and we, could be a short update, it could be an involved update, but I think just getting this information and using every method we can to get the word out is what our intention is. And to tell you the truth, I was surprised at that 458,000 number. Vaccinations and across the state of Minnesota. I, for some reason, thought we were way below that number. So I feel heartened by that. Do you have more to cover, or does Mr. Shute have anything to add?
Not a lot to add. What I do bring to Laura and the team, thank you, Council President, is leveraging the city departments. Not only the city council is asking where you guys can support and gals can support the mayor's office, but also in helping the public health team perhaps select the next site for vaccinations that maybe speak to and beat down some of the barriers that transportation may pose, or that targets the right population. Because if we were just to go big, that would be logistically easy to service, but that would not vaccinate the location and the populations that need it the most. So we are fully engaged at the city with the public health department in the process and the rollout to resource and coordinate what we need to do to be successful.
Thank you. Are there any final questions before we move on? Mr. Tolbert. Okay.
I didn't mean to press it.
There's actually been a lot of funny pressing buttons things that have happened today behind the scenes. I think it's not a full moon. That was last week. So Ms. Anderson, Mr. Shute, thank you so much for your incredibly hard, dedicated work on this. And I seconding what Mr. Tolbert said, and I saw people smile. It's like there's adults at the federal government leading this charge now, and hopefully we will be getting, it may not be the information we want to hear, but hopefully it will be consistent, because I know we rely on that information to make our plans for our school districts, for our city, for our county, for our community members, and to try to communicate. And when the ball is moving, it's very hard to create a trusting environment. And so, we want to be part of that trusted network, and really look forward to having clear communication. I'm coming from the top all the way down in the weeks and months to come, and hopefully that makes your lives a little bit easier. And I know it will make our community members' lives easier. So thank you, and we are really grateful for your work in this incredibly challenging year. So thank you so much. All right, we are going to move on to our next topic. Thank you so much.
Item number 22, second reading of ordinance 21-3, granting the application of NBH Holdings LLC to rezone the property at 1350 Arcade Street and 835 Clear Avenue from R4 one family residential to T2 traditional neighborhood, and amending Chapter 60 of the Legislative Code pertaining to the zoning map. This ordinance is laid over to February 10th for third reading public hearing. Item 23 is first reading of ordinance 21-7, amending and replacing ordinance 10-779 and authorizing the issuance of general obligation library refunding bonds of the Public Library Agency in order to achieve debt service savings. This ordinance is laid over to February 10th for second reading. Item 24, Resolution Public Hearing 21-13, adopting the 2021 operating plan and corresponding budget for the Downtown Special Service District and amending the city operating budget.
Right, and this is a public hearing. We've held it open for comments online by email and also over the phone. And as such, Ms. Naker moves to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 25, Resolution Public Hearing 21-15, amending the financing and spending plans in the fire department in the amount of $121,105.96 to accept the 2019 Assistance to Firefighters Grant to provide paramedic training for firefighters.
And this is a public hearing. We've held open online, over the phone, and by email. And as such, Mr. Tolbert would move to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 26, Resolution Public Hearing 21-16, amending the financing and spending plans in the fire department in the amount of $89,400 for a contribution received from the Minnesota Board of Firefighter Training and Education to pay for training for firefighters.
And this is a public hearing. We've held online, either by phone or by email. And as such, Ms. Jalali moves to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. We now need a vote for reconsideration of the next item.
All right. Ms. Naker moves for.
You, Mr. Tolbert.
Oh, okay, I'm sorry. Mr. Tolbert moves reconsideration. Roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The council has approved the reconsideration of this item. Item 27, our Resolution Public Hearing 21-6, approving the petition of Maureen Mikulski of Ryan Companies on behalf of Project Paul LLC and Presbyterian Homes and Services to vacate air rights over Mount Curve Boulevard, abutting blocks 6 and 7 Ford Platte.
And I believe this item was simply a technical, or not a technical, a scrivener's error. We noticed it with the wrong date. Is that true, Mr. Tolbert?
Yeah. Yeah. Thank you. It is. We did approve it. We heard it and approved it last week, and it was a technical issue with the public notice that was noticed actually for today. So that's why I'm bringing it back for reconsideration to hold another public hearing in accordance with the notice requirements for the properly noticed date. I know we'll be here. The comments should be online and from the phone. So I would move approval to close the public hearing and approve.
All right, so Mr. Tolbert moves to close the public hearing and approve, acknowledging that we have had public input over electronic methods such as email and phone. And again, this was simply noticed wrong. We did pass it previously and we're reconsidering it today. Any discussion on the motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. The legislative hearing officer recommends adoption of the following resolutions as no objections to these recommendations were received. Item 28, RLH TA 20-648, 1366 Almond Avenue. Item 30, RLH TA 21-77, 1696 Boland Avenue. Item 31, RLH TA 21-73, 733 Case Avenue. Item 32, RLH TA 20-662, 1092 Edgerton Street. Item 33, RLH TA 20-223, 55 Fifth Street East. Item 34, RLH FCO 21-3, 687 Fifth Street East. Item 38, RLH BBR 21-4, 1053 Lawson Avenue East. Item 39, RLH FCO 21-6, 2053 Lincoln Avenue. Item 41, RLH TA 21-71, 1155 Margaret Street. Item 47, RLH BO 20-46, 1547 Sherburne Avenue. Item 51, RLH TA 20-172, 882 Westminster Street. Item 54, RLH AR 20-61, securing or boarding services. Item 55, RLH AR 20-64, towing of abandoned vehicle services. Item 56, RLH AR 20-65, 1425 6th Street East. Item 58, RLH AR 20-158, property cleanup services. Item 59, the last one, RLH TA 21-86, 397 Thomas Avenue. And again, the motion would be to adopt these items.
Right, so moved by Mr. Tao. Any discussion on that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearings are closed and the resolutions are adopted. For the following items, no objection to the legislative hearing officer's amended recommendation was received, and therefore she recommends amendment and adoption. Item 36, RLH BBR 20-71, 1823 Hewitt Avenue. Item 37, RLH RR 20-55, 578 LaFond Avenue. Item 45, RLH TA 21-83, 1663 7th Street East. Item 48, RLH TA 21-76, 306 Sydney Street West. Item 52, RLH AR 20-52, property cleanup services. Item 53, RLH AR 20-53, property cleanup services. And item 57, RLH AR 20-157, property cleanup services. And again, the motion would be to amend and adopt these items.
All right there. So moved by Ms. Yang. Any discussion on that item or that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearings are closed and the resolutions are adopted as amended. For the following items, the legislative hearing officer's recommendation is to continue the public hearing to the named dates. Item 29, RLH TA 20-708, 37 Atwater Street, July 7th. Item 35, RLH TA 20-288, 0 Herbert Street, February 17th. Item 44, RLH TA 21-36, 1187 Rainy Avenue, July 21st. Item 46, RLH TA 20-680, 901 Sherburne Avenue, July 7th. And item 50, RLH TA 20-659, 663 3rd Street East, May 19th. And the motion is to continue the public hearings to those named dates.
So moved by Ms. Prince. Any discussion on that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The public hearings are continued to their pertinent dates. For the following item, the legislative hearing officer's recommendation is to refer to legislative hearing on March 2nd. Item 40, RLH TA 21-82, 52 Litchfield Street. And again, the motion is to refer to legislative hearing on March 2nd.
On the notes I'm looking at, Bill, the sponsor is not listed. Can you tell me who's 2182 Litchfield?
Let me confirm that for you. Just a moment.
No one's raising a hand either. Sorry.
That is Councilmember Tao's ward, ma'am.
Okay, thank you. So moved by Mr. Tao. Any discussion on that motion? All right, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The resolution is referred to legislative hearing on March 2nd. For the following item, the legislative hearing officer's recommendation is contested and additional testimony from the appellant is in the record. Item 43, RLH TA 20-660, 542 Ohio Street. And we do have a staff report.
Ms. Mormond, welcome.
Thank you, Council President Brenmoen. This is a special assessment for the removal of a piece of furniture from the boulevard. We did receive an objection to my recommendation on January 28th. It is attached to your record and has been in front of you for the past week. I will note that the removal of this upholstered chair was ordered on July 23rd of 2020 with a deadline of July 30th, 2020 for its removal. Notice was sent to the owner. There was no return mail. Excuse me. The owner said that he did not get notice. However, he did indicate that he was at the property painting frequently during this time period. He also said that people often leave valuable items that someone else may want in the boulevard for free pickup. Nobody did pick it up. Notably, it did rain 3/4 of an inch before the pickup deadline by Parks and another 1/4 of an inch before the city actually showed up. So it would have been not in the best condition. I can show you, this is a photograph of the item in question that was there for about 2 weeks. So my recommendation in this case actually is not approval of the entire assessment for $478. My recommendation rather is to reduce the assessment if there are no same or similar violations by May 17th of 2021. The owner is objecting to that and does not think that he should have to pay any assessment. He has some other comments in the letter he attached, which I'm sure you've had a chance to look at. I would note that for one of them, he believes that my recommendation to the council changed between the original legislative hearing and the item being in front of you today. I think that confusion may have arisen because the real estate office re-noticed the hearings that you're conducting these days to confirm for people who have assessments in front of you that the council is continuing to hold these hearings remotely and by voicemail and by email. And so I think that what happened is that reduction was not reflected in that notice that he received, but there's nothing in the resolution in front of you that's different from then until now. I just wanted to clarify for the record that he did mention that in his letter. He had a number of other things to say in the letter as well, if you won't have questions about that.
All right, thank you, Ms. Mormon. And I just remind people that we have bulky garbage service these days, and they pick up couches and chairs that look just like that. And it's included in part of the garbage cost. I say this as more of a public service announcement than anything, but those items do qualify for our bulky service pickup. Are there questions from Ms. Mormon? All right, Ms. Naker.
Thanks, Council President, and thanks, Ms. Mormon. I did have a chance to look over all of the materials in the record, and I think that Ms. Mormon's recommendation for the $100 reduction, if no same or similars, is extremely appropriate. I would say very generous, given that there have been a number of calls to this property, and that it seems very clear to me that the letter was sent to the correct address where the owner explains that he was. So I would move the legislative hearing officer's recommendation.
I would support your motion and agree that it's very generous. Any other discussion on the motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao, Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. For the following item, the legislative hearing officer's recommendation is contested and additional testimony from the appellant is in the record. Item 49, RLH TA 20-210, 836, 838 Smith Avenue. And we have a staff report.
Ms. Mormont.
Council President, this is an assessment for boarding of the property. On December 10th of 2019, a vehicle encountered some ice and slid off of Smith and into the front of this building, causing extensive damage and necessitating the boarding of fully half of the storefront. I can tell you that the cost of this boarding is $657. Now that includes an emergency call out fee of $250 plus labor and materials that were used. The police were the ones who called out the boarding contractor after they indicated in their police report they were unable to get a hold of the building's owner. Clearly, there's a lot going on here, and the owner herself talks about how difficult this is in the context of the earlier reconstruction of Smith Avenue and the impact of that on the business, and then the subsequent impact of COVID on her business, that this is really hard. I'm not clear to this day yet about where she's at with insurance reimbursement to be able to address the damage that was caused. She did indicate in the hearing that it wasn't covering all of the costs that she had incurred. And I would like to follow up a little bit more to see if that has been clarified or if there's information that the city can provide that may help her with that. Let me show you a photo of this is the building here, and you can see that fully half of the storefront needed to be boarded, and that was the area with the gas meter present. So this was definitely a dangerous circumstance that needed to be addressed immediately. My recommendation after discussing this matter with Council Member Naker is to rather than make the payments over 3 years, to extend that time period in light of COVID to 5 years, noting that the interest rate these days that the city uses is someplace between 3% and 4%, depending on the timing, but also to push out a public hearing and continue it for 8 months out to give an opportunity for her to be able to work more with the insurance to see if some recovery can be made. That would mean I'm asking for a continuation of the public hearing to August 6th of 21, or excuse me, October 6th of 21, and an amendment to divide over 5 years rather than 3.
All right. Are there any questions for Ms. Mormond? All right. Seeing none, Ms. Naker.
Thanks, Council President. Thanks, Ms. Mormon. This is just a heartbreaking situation for this small business owner on Smith Avenue, just right in the middle of the pandemic. And I appreciate very much the recommendation to allow this to be paid over 5 years, and also to continue this until October. I think it does sound like there is insurance both on the store owner's part and also the driver's part that should be brought to bear here. And I would like to give that time for that to be figured out. So I would support the recommendation of the legislative hearing officer and move that.
All right. So moved by Ms. Naker. Any discussion on that motion? Seeing none, roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
7 in favor, no one opposed. The resolution is amended and the public hearing is continued to October 6th. And our last item. For the following item, the legislative hearing officer's recommendation is contested and additional testimony from the appellant is in the record. Item 42, RLH TA 20-230, 888 Maryland Avenue East, and we have a staff report.
Ms. Mormond.
This assessment is for $528. It is another emergency boarding situation. On December 19th of 2019, the police received a phone call from a pedestrian that 888 Maryland was open to entry, at least in 2 locations. The police went out and confirmed that the building was open and searched the building, cleared it, and called the boarding contractor to secure it again. The boarding contractor was able to use the same boards that had been in place. They were simply moved and set aside, so they were re-screwed in and the building re-secured. The owners were present in the hearing, but they also have a realtor who communicated to us after the beginning of this meeting. It was brought to my attention, and the realtor indicated that his client thought that the building was boarded prior to when they took possession in October, and they didn't see any additional boarding after they took possession, so they didn't understand why they were being charged this assessment. The realtor wasn't present in the hearing, and so he didn't get a copy of the police report and wasn't privy to that conversation. We forwarded him that record as well as the police report showing. I will note that this particular building was demolished within a week of the boarding, so what had been a very troubled property for a very long time, in fact, a property that had been in front of the city council for demolition for a very long time, did get demolished shortly after this securing. That doesn't diminish the importance of securing a building. Bad things happen in open, derelict buildings, so important to get that taken care of. My recommendation is approval of the assessment.
All right, and Ms. Mormon, you said the building has been since demolished?
The building has since been demolished.
Okay, I was looking on my map to see what building it was, and there was no building, so that explains it. I got it. Okay.
It's adjacent to the Golden Harvest store on Maryland. Yeah, it was the old Taco John's building when there was a Taco John's there.
Okay. Yeah. Okay. That makes sense. I just looked it up and I was like, what? Okay. That's great. Are there any questions for Ms. Mormond? All right. Seeing none, Ms. Yang.
Thank you. Thanks, Marsha, for the details. I will be taking your recommendation.
All right. So Ms. Yang moves the recommendation of the legislative hearing officer. Any discussion on that motion? Seeing none,
Roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
7 in favor, none opposed. The public hearing is closed and the resolution is adopted.
All right, that brings us to the end of our agenda. Before we adjourn, does anyone have news from the ward or beyond that they'd like to share before we adjourn? Ms. Prince.
Yeah, the Minnesota Youth Ski League is presenting a wonderful opportunity at Battle Creek Rec Center, teaching cross-country skiing lessons on the ball fields on February 10th, 17th, and 24th from 5:30 to 6:30 p.m. for ages 6 to 12. All the equipment will be provided, but due to COVID regulations, all participants need to pre-register, and the space is limited to 20 participants. To register, go online at the Minnesota Youth Ski League, which is mysl.org/ski. And Battle Creek Rec Center can also answer questions if you want to call over there. So there it is.
Thank you. Does anyone else have news from the wards and beyond? All right. We've had a full packed meeting, and I sort of promised this morning that we would adjourn while the sun was still shining. And you know what? It is. So let's do it. Thanks for everybody for your hard work and dedication today. And with nothing more in front of us, we are adjourned.